really want to zero in on this whole concept or definition of Lyme literate doctors, because it could be a regular practitioner that just went for a weekend seminar on Lyme disease, and all of a sudden they come out like 4 days later and now they're Lyme literate because they took this course. That's a very different doctor than someone like you that's focusing 100% of your energies on innovations and the different kinds of combinations of integrated medicine that will treat the individual case and the symptoms that are presenting. That's a very different kind of doctor. And why it's important out there for all of you, because even in our history, we probably found, a bunch of different doctors over time, and many times Lyme patients, they get some results, they go into remission, then they relapse again, then they find another doctor, and they go on from doctor to doctor. And so you have to be very discerning as to which practitioner and why, and what their history is, and what their history of success working with patients and their overall philosophy about their approach. And that's part of your intake, right? You interview the patient, they interview you, and then you have a like-minded game plan that you put together, and then you go for it. So I think that is really important for the people out there to know. And it also helps the doctor because a big part of the relationship has to do with patient compliance, and the success of the program is really on both parties, like making sure that everybody buys in and is part of it. By the way, if you need to get a hold of Dr. Bock at any point, probably the best way to do it is just calling his practice directly, and you can dial it at 845-876-0300 and just ask for his intake PA, a woman by the name of Christina, and she'll get you all hooked up and get you directly in touch with Dr. Bock, and then you can work things out. You could always go to his website, which is Bock, BOCKMD.com, and you can find and take a look at some of the things he's doing there that are very interesting. But the best way to get directly to Dr. Bock is just going to his practice. How simple do you make that, right? So let's go into integrated medicine in general. Like, what does that mean? And what's the value to a Lyme patient that you go to a practitioner, they have a traditional approach, versus someone like yourself that's looking at it in an integrated way or a functional way and combining all these different modalities? You touched on it, but let's dive in a little
like
bit
you
deeper
said
on that one.
in the beginning, you get some people who go to a weekend course. So you have people who have done integrative medicine. Integrative medicine is functional medicine, and how that's different from how we're taught in Western medicine is concerned with pathology, uh, problems with the gut, problems with the brain, which is a neurologist or a psychiatrist, problems with the heart, which is a cardiologist. And one of my mentors once gave a picture of a circle of all the information that we know, and then he drew pillars up from that circle for each specialty. So immunology, cardiology, GI. But so you need specialists, but sooner or later, when these pillars go up and up and up in the whole circle of information, the specialists know more and more about nothing. And I'm not saying that to be arrogant, because you need your specialists, but if they don't relate to the patient in the context of what their illness is, they're just checking for cancer or checking for a heart attack. And a lot of my patients go to a cardiologist with palpitations and chest pain, and they don't have a heart attack, but they have Lyme cardiac problems. And the cardiologist just, well, what do you want me to do? You could have Lyme. I don't really know about it. So it's important. So the thing about integrative medicine, it is it's different than regular medicine in the duality. Medicine is black and white. So it's like, for instance, IDSA's concept and ILAD's concept, duality. Lyme, don't have Lyme, duality. The body is a duality. The body is like positive, negative, catecholamines, serotonin, the neurotransmitters, both sides of things. So you have to be aware that there's this polarity in the body, and it also deals with when you see a patient, how to prioritize what's going on. And this is where I think you touched when someone goes to just a weekend course and they come out and saying, well, I know about Lyme, I'm going to put you on 5 antibiotics. And they don't look at the person's other symptoms, how their level of toxicity is, how the level of their GI function. So I think what an integrative Lyme practitioner does is prioritize. You get the concept of who's in front of you. They tell their story. Usually my first visit is an hour and a half. I get all the information about what's happening, and then I prioritize. When do I kill the microbes? When do I support the body? When do I support the immune system? When do I support the endocrine system? When do I detox them? When would antibiotics be too harsh? Maybe using herbs. When do I think about ozone, which can not only kill the pathogens, but can dampen down an overactive immune system while also tonifying the immune system? So it's two-pronged attack and stuff like that. So I think, I find that patients nowadays, in addition to their Lyme, have so many problems with toxins, just in the environment, pollution, medication that they're taking, stress, and also the tick-borne disease, which causes, problems.
Yeah, you segued perfectly into the next area that I wanted to talk to you about, which was detoxification. But before we go there, I just want, for people that just tuned in, Dr. Bock, what you just described is you, like if we were playing football, you need a quarterback. Like you're the quarterback. As an integrated functional doctor, you're looking at all the components, as opposed to the different players like the halfback and the cornerback and all these other guys. They're specialists. And many of the patients out there, many of the Lyme community, they fall prey to just what you described. They have a symptom, they think they go to the specialist knows a lot about neurology or psychiatry or whatever, but they're not looking at it from the Lyme perspective, like you do, in a sense. And so they treat that little specialty area without understanding all the other components. And as you described a few minutes ago, it's a complex situation. Everybody's body interprets Lyme differently and in different stages and in different ways. And so knowing the order to do your therapies and the ways to dose and fine tune that order, each of those components, makes the difference between sort of an average mediocre result or an optimal result as a therapist, and obviously as the Lyme patient getting back to their lives. And that's really a huge difference, and what everybody out there should look for in their practitioners. So we're giving you sort of the ground rules of the kinds of questions to ask and the things to look for. And this is so beneficial.
The Healthy Hotline is your go-to resource for leading-edge health technologies and is powered by Therasage. Therasage brings unique, healthy infrared healing energy to the public in easy-to-use and affordable, high-quality products. To learn more about Therasage, as well as get a discount on your next purchase for being a listener of the show, go to Therasage.com and enter Healthy Hotline at checkout. That's one word, Healthy Hotline, to get a special discount on your next Therasage purchase.